is hosted by the Washington Group on Disability Statistics and organized by IDA, CBM Global, and the stakeholder group of persons with disabilities. And the Washington Group would like to thank all of our sponsors for their support. And on behalf of the Washington Group, I just want to say that we greatly value our ongoing partnerships to improve the availability of disability data and our understanding of the power of the data and how to use it. And we really do value these partnerships in moving this forward. The event will be recorded and shared later. Oh, and I should have introduced myself. I'm sorry. I am Jennifer Maddens, and I chair the Washington Group on Disability Statistics and also representing the Secretariat today. And as I said, the event will be recorded and shared later. International sign interpretation and live captions are being provided, and the international sign interpreter is spotlighted, and the captioning is available by clicking on the closed captioning box on the bottom of the screen, and also available in a separate link that has been shared in that chat box. Many thanks to IDA for providing the international sign interpretation and live captioning. We're very grateful. Presenters and the moderator will use their cameras while presenting, but we ask others to turn cameras off to kind of keep on the bandwidth. We will wait to answer questions until the presentations are done, but please feel free to ask questions at any time in the question and answer box and the chat box, and we'll return to those after all the presentations. I also wanted to mention that the Washington Group has plans to host a series of webinars this year and into next year. And we welcome partners, as we have today, in this activity. We're interested in the topics for webinars that you might be interested in hearing. And we ask you to share any topics of interest that you would like to have us do a webinar in the chat. We'll try to put that on our schedule. And if you would like to partner in doing a webinar, please let us know that as well. We'd be very happy to partner with you. I'd like to now introduce our three presenters for today. They will present on citizen-generated data and persons with disabilities. I'll introduce all three of them now to save time as we go through the presentations. First, we have Dr. Elizabeth Lockwood, who works for CBM Global and is the representative to the United Nations. She will introduce citizen-generated data and provide information on the UN Collaborative on Citizen Data. Our second participant is Jose Vieira, permanent representative of the stakeholder group of persons with disabilities and interim executive director of the International Disability Alliance. Jose will present about citizen-generated data from organizations of persons with disabilities. And then third, we have Sarah Roca, the data manager for the University of Cambridge, who will present summary findings from a survey she carried out as a consultant with organizations of persons with disabilities and other stakeholders to assess the use and gaps of the Disability Advocacy Toolkit. The survey further explored data gaps and gathered OPD-led citizen-generated data. So now I'll turn the floor over to Elizabeth to start the presentations. Well, Elizabeth, the floor is yours.
Thank you so much, Jennifer. Thank you for having us. I am going to share my screen, my presentation. Just one moment. Oh, where did it go? Hold on. Aha. Okay, apologies. Okay, not so good at that. Welcome, everybody, and we're very pleased to be here so we can talk about citizen-generated data and persons with disabilities. I will begin by talking about citizen-generated data in general, and I think this is very important because not a lot of people have an understanding of what citizen-generated data means, and this is something that there isn't a set definition, but we use a variety of definitions to come up with our definition. First, I will note that the term citizen here refers to individuals in a society without implying any connotation related to citizenship or legal status associated with a person's country of residence. So taken from different definitions, we define citizen-generated data as data that individuals or their respective organizations, produce to directly monitor, demand, drive change on issues that profoundly impact them and their lives. These data are generated through various means, such as surveys, emails, reports, storytelling, social media, and more. Data can be either quantitative or qualitative, structured or unstructured, or open or closed. It's important to note that citizen-generated data are not intended to replace official statistics, but rather it's a very important complement, and they should be worked together and merged together in some cases. I will talk about the UN Collaborative on Citizen Data later, but the definition that we are using in the collaborative, which I think is very nice and is also on the PowerPoint, is that citizen data are defined as data originating from initiatives where citizens either initiate or are sufficiently engaged, at the minimum, in the design and/or collection stages of the data value chain or the data cycle, irrespective of whether these data are integrated into official statistics. So why are citizen-generated data important? In our work, in our advocacy, in our data advocacy in particular, in the past many years, we have noticed that we're still lacking data disaggregated by disability. It might be there, but it's not being recognized, measured, or it's outdated or not harmonized. And this affects the implementation of the 2030 Agenda, also the Convention on the Rights of Persons with Disabilities. And specifically, a lot of the work that I do is around the Sustainable Development Goals. And I'm sure, as you all know, there are many indicators that are disability inclusive, 11, and then many others can disaggregate by disability status. But the SDGs report from 2022 indicates that there are only 2 indicators that actually do disaggregate globally by disability status. And then following up last year, the report stated that persons with disabilities were one of the most urgent groups left behind in urgent need of focus. So that is really saying something, that we need to focus more on data. And what the result has been that the UN and national statistical offices, especially around the SDGs, that there's an interest in finding other forms of data to measure for persons with disabilities, the implementation of the 2030 Agenda. And this has been a very positive thing, I would say, and I've really noticed the change in the last 2 or 3 years. And from this, we have seen different initiatives. And the one that I'll talk about today is the UN Collaborative on Citizen Data, specifically looking at this, filling these critical gaps that are not being measured to implement the SDGs. And you all are welcome to join. So I will start with that, and we would really like to have you join. So after I present, I will put the link in the chat so you can see that. And just to give a little background on the Collaborative on Citizen Data, the UN has a few collaboratives, and it's an initiative that's multi-stakeholder in nature, but it is hosted, the Secretariat is the UN Statistics Division SDG section. And then there are different steering committee members, and we are one of them as a stakeholder group of persons with disabilities. And there are others such as the World Bank, UN Women, Paris 21, and many others. And it's a really excellent example of a collaborative looking at different forms of citizen data. And we use citizen data because academia is involved. So that does encompass citizen-generated data as well. The impetus of this collaborative, as I mentioned before, was the lack of data, especially for marginalized persons, to measure sustainable development and the Sustainable Development Goals. And at the same time, the official statistical community also increasingly is recognizing the importance of non-state actors in contributing to data inclusivity and producing statistics. The collaborative was first established in 2022 in a UN meeting in Bangkok, and Jose and I had the pleasure of attending this meeting. And then the next year in the Statistical Commission, the collaborative was presented. And very positively, tomorrow in this year's Statistical Commission, our collaborative and framework, which is called the Copenhagen Framework, will be presented in the morning, if you're interested in watching. We have 3 specific objectives in the collaborative: to develop the conceptual framework, the collaborative framework called the Copenhagen Framework. And that is almost done, but you can input. I will provide that link too. And second, we are creating a roadmap for citizen data. We will lead the implementation of the framework and activities, and also serve as a platform for exchange. So we will also have webinars and informations and sessions to come together on citizen data. So we really welcome you to join, and it's very exciting. We had our in-person event Monday night, and it was very crowded, and many statisticians were there for the Statistical Commission. So very pleased. We had our partner from the World Federation of the Deaf present, and just to show an example of marginalized groups and how they collect their own data and how this can complement official statistics. And I will stop here, happy to answer questions later, and we'll pass it over to Jose Vieira, who will talk more about citizen-generated data and the role of persons with disabilities. Thank you.
Thank you, Elizabeth. Thank you, Jennifer, and thank you to all the colleagues from the Washington group for organizing this webinar. On behalf of the International Disability Alliance, the stakeholder group of persons with disabilities, and all our partners, we are delighted to have the opportunity to share with you all some of our views regarding the engagement of OPDs in this very interesting and very much needed agenda. The first thing that I would like to address is a little bit of a recap in terms of why data is still an important issue for persons with disabilities. And I'm sure most of you will agree with me first that clearly persons with disabilities and data about persons with disabilities remains and a topic that needs further investment, not only because in general, and we can use just as an example the SDGs monitoring mechanisms. The global indicators to measure the progress on SDGs are in general lacking of data, but the situation is even worse when it comes to persons with disabilities, acknowledging that less than 10% sorry, of the global indicators that refers to people with disabilities are actually collecting data on persons with disabilities. The second thing to highlight as a recap of where we stand in terms of the need for further investment on data is the fact that we have seen through COVID, but also through other humanitarian crises, that the lack of data has resulted in poor policy discussions and even less productive or useful programming when it comes to provide supports to persons with disabilities. So clearly, the lack of data has a concrete negative impact in the capacity of developing or design programs and projects that can serve the needs of persons with disabilities. The last thing that I would say in this little recap, the fact that OPDs are still in this learning curve in terms of how to engage with the data agenda, it's also something that we should look at as one of the factors that somehow impact the capacity of having accurate, comparable, and useful data on persons with disabilities. However, what we have seen in the last couple of years is that as a result of great commitments from different stakeholders, many of which are in this virtual room and to whom we are grateful. There are some concrete progress, I would say, in mainly 3 fronts. Number one is understanding that better data on persons with disabilities impact positively in our capacity to define advocacy priorities and to consequently design programs and initiatives around persons with disabilities in any agenda, from education to employment, from social protection to transport, community inclusion, et cetera, et cetera. Number two, that clearly more and more stakeholders understand the need of engaging organizations of persons with disabilities, as we are the representative platforms through which issues related to persons with disabilities and data can be addressed, but can be addressed in accordance to CRPD standards. And I think that's something that we should highlight, that is happening more and more. And the last thing that I would say here, and kind of this taking stock exercise of what we have seen in the last couple of years, is that organizations of persons with disabilities, we are more aware of what our role can be in this agenda. And our role can be in different ways. I would say first in advocating for more data. Secondly, to start using more and more data for our advocacy work, but also for our programmatic work. And maybe the third and most important one is that OPDs can also generate data. And that basically connects to the main theme of this webinar today, which is citizen generating data. Clearly, our position as OPDs is that citizen-generated data can be a great complement and an additional tool for the already existing methods and stakeholders collecting data. But it's clear, and it's coming from bottom to top when we talk to different OPDs around the world, when we see different projects going on in different countries that OPDs have, we have a privileged position where we can connect our members more easily, we can reach out to our members more easily, we can bridge some gaps or fill some gaps in terms of internet connectivity. We can also reduce those cultural gaps that sometimes exist when it comes to more formalized ways of collecting data. So the fact that OPDs have that privileged position, especially with regard to persons with disabilities, when it comes to different initiatives, I think that also impacts positively in this idea of citizen-generated data, always, and I really want to be very clear, as a way of complementing already existing data. Couple of things that I would like to say, just in closing as a reflection moving forward. I think we are way more advanced in understanding the need of collaboration between data experts, national statistic offices, different stakeholders working in this agenda, and organization of persons with disabilities. And I would just mention 4 concrete elements or examples that illustrate, in our view, that strengthened collaboration that we see more and more happening both at the global and the national level. Number one is that there are more initiatives around data, inclusive data. Clearly, a lot of more members in IDA and other organizations of persons with disabilities are engaged in this agenda, especially at the national level. Number two, we clearly see that that OPDs are better equipped and more skilled to collect data. I will never forget some of those initial workshops that Jennifer and many other colleagues used to deliver in different countries around data. And I think if we look at what the things that we were discussing in those workshops, and now that OPDs are already leading advocacy strategies in different countries for data, for collecting data, et cetera, we see the path that we have came together through. Number three, it's clearly that data on persons with disabilities is more used on policy discussion. So now when we do advocacy, we clearly introduce more and more data and more elements that comes from the information that is collected through data. And number 4, I would say that there are many more stakeholders that are aware of the need for an inclusive data collection process. So if we combine more OPDs aware of the need, stakeholders more conscious of the need of including OPDs, more inclusive initiatives, and clearly the use of data, what is the benefit of collecting good data for policy discussion, we can clearly see that there is a good recipe for moving forward, always reminding that we need further investment, we need more support, and we need this awareness raising permanent action that we do, and I'm sure everybody in this room does, in terms of the need of increasing data for persons with disabilities. In general, my observation is that we are advancing, progressing quite well. Nevertheless, more work is needed, and from IDA, we are ready to keep supporting many of the initiatives that we have seen today are perfectly good examples of how to move forward around data. Thank you very much, and I will now pass over to Sarah.
Thank you so much, and thank you for inviting me to participate in this webinar today. I will share my screen. Hope everyone sees it.
Yes.
Yes.
I will talk about 2 of the reports that originated from this consultancy. One of them is a report on the lessons learned from the Disability Data Advocacy Toolkit, and the other one was a compilation of case studies of data generated by organizations of persons with disabilities. In terms of the report on Disability Data Advocacy Toolkit, we published and shared an online survey. We had 34 organizations responding to that survey, where 23.5% were aware or using the toolkit. We had from countries 6 in Africa, 6 in Europe, 5 in Asia, and 1 in South America. We know it's a limitation. We needed a lot more organizations to answer, but it still gave us some really interesting feedback. We asked the organizations that use the toolkit what they use it for and what were the lessons that they learned by using it. And the main ones were to improve capacity building, collect disaggregated data, and analyzing the needs of the persons with disabilities that they support, to consult on best practices, and to train persons with disabilities and OPDs on citizen-generated data. In terms of lessons learned, they mentioned the need to capture more disability disaggregation types with the Washington Group SAP. We now have the extended, the enhanced, there's more and more possibilities. But for example, we got for organizations that focus on the autistic community, for example, it's a bit more difficult to capture at the moment with the Washington SAT group. They mentioned more training on how to use the toolkit. There is workshops, as it was already mentioned in this webinar. The toolkit needs to be updated often and needs to map all the stakeholders involved in data advocacy and have a collaborative approach. There is also a need for creativity, innovation, and out-of-the-box ideas. In terms of the organizations that were not aware of the toolkit, they said they needed training, especially on the practical applications of the toolkit, and other formats and languages, including Word format in Portuguese and national sign languages. They also expressed the need to build capacity on disability data, to be the first one training workshops on how to manage, analyze data, then workshops on the disability data advocacy workshop, funding a short informative video that can be used for teaching purposes, a technical data webinar series, small data related project and technical support, and finally access to an external data team. In terms of, we ask on the survey, what type of national disability data do they have available? The responses, we got a lot of contradictory responses on what type of disability data was available in their country when there was more than 2 answers from the same country. And if OPDs collect data or if their National Statistical Office recognizes that data. Some countries in Africa and Asia, say community citizen-generated data was recognized by their National Statistical Office, but not in Europe, for example. In terms of accuracy, we ask if they felt the data that they got was accurate. Only 11.8% of the responses reported that the available data provides them accurate information about persons with disabilities in their country. And finally, we ask if it was enough for their advocacy, and only 17.6% reported that the available data was enough for the work they do in advocacy. We ask them also what are their data priorities, what do they feel they need, they're still not accessing. It was divided into 4 main topics. One of them was human rights violations, so harmful practices, violations to sexual and reproductive health and rights, psychiatric abuse, for example. There was the topic of independent living, education and employment. They wanted to know the number of people in institutions, a number of people in segregated and mainstream education, or a number of disabled people in sheltered workshops, for example. In terms of access to services in needs, they mentioned difficulties accessing rights and public services, specific needs of persons with disabilities and support available compared with needed, and political participation and civic engagement. And finally, the 4th topic was the technical needs on data collection and management. So it was more related with the disaggregation, publication of data kept by entities and ministries of health, education, transport, employment, etc., that are sometimes, most of the times, not published publicly. Community engagement and consultation of OPDs, and to improve reliability and quality of data. They also mentioned some challenges, and I also had contact with several OPDs on how to build this. They found availability of data, so it is difficult sometimes to access. It's sometimes not accessible also for persons with disabilities. Capacity, organizations don't have a lot of capacity to build more citizen generated data. Comparability, the data is sometimes not comparable. As you can see here, I also talk about the differences in models. So we have the medical model that provides data for disability in healthcare, disability assessments, access to benefits, etc. And then we have the social model, like the Washington Set Group, that is used for the data in census and governmental surveys. And then we have data generated by the OPDs that is a little bit more aligned with the human rights model. And so the fact that we have this growing and evolution of the definitions of disability, it means that we have data that it's uncomparable throughout these models, and we need to ensure to develop more comparable forms to provide the data we actually need. OPDs want leadership, not consultation. They found a difficulty in terms of functional difficulties versus disability groups. A lot of OPDs in generated data are focused on disability groups, specifically the organizations that are specific for a disability type. Methodological issues, and they need more disaggregation, barriers and facilitators to access services, which are normally not explored enough. The funding to develop this type of projects, accessibility of data, the difficulty in data reporting and making it accessible, the need for advocacy, the need for community level qualitative data instead of just quantitative data, the data interpretation and access. And they also mentioned being difficult to access ethics committees and scientific publishing that will bring more credibility to their data. And finally, they found it was limiting access to raw data. So especially the official data, National Statistical Office sometimes publish reports and not the raw data. So they struggle a little bit more in accessing and managing the data that exists. In terms of recommendations, we recommended training for national and local organizations and translation and accessibility of the disability data advocacy toolkit. So more than we already have. You can see there's easy read guides also. A database of the disability data resources with National Statistical Office information on disability data per country that is accessible and easy to use. Developing guidelines of what data stakeholders need for their advocacy, a disability rights monitoring tool with continuous funding, and research on frameworks of disability data for advocacy, and especially developing guidelines on what data stakeholders need for the advocacy and harmonization of that data as a whole. Finally, we had the report on case studies of data generated by OPDs. We analyzed 23 case studies in total. The objectives was to gather these examples and best practices, to analyze them and show the importance of the citizen-generated data, to complement official statistics, but also to provide practical examples for other OPDs that wish to do the same. We had topics from COVID-19 to employment, access to justice, sexual and reproductive health, priorities in policy, independent living, restraint and seclusion in schools, gender-based violence, political participation, barriers to healthcare, and others. As you can see here, I put just an example. This is the case study 5, which is the COVID-19 Disability Rights Monitor that was developed by several organizations. And in the report, we show what question was explored in this case study, the organizations that were responsible, the location of the projects, website, goals of the study, a little bit on methodology, key findings, and the results and where you can consult them. And finally, we realized that there's a need to centralize information on disability data and provide comprehensive country-specific data to organizations, since there was a lot of contradictory answers on what disability data exists in each country and what are national statistical offices available to accept from citizen-generated data for OPDs. The National Statistical Office should include functional difficulties questions in national surveys, as well as expanding the scope of related inquiries. OPDs can support the National Statistical Offices to fill gaps of data if they recognize their data and work with OPDs. We need to map all data needs on disability by all stakeholders. That should take place to understand what questions OPDs need to include in national data to get accurate data they can use for their advocacy and to monitor progress in the rights and policy. Data disaggregation, it's very important across all governmental areas, not just the census, but we need to expand this comparability in employment, disability, education, migration, social justice, economy, and health to ensure that organizations have access to useful information. The OPD's data priorities show that more than a shift from the medical model, the social model of disability in data, the organizations show an interest in reframing data to the human rights model, aligned with the Convention of the Rights of Persons with Disabilities. I would like to emphasize the urgent need for qualitative data on personal experiences and individual barriers and facilitators that can give us a better insight on the global needs in terms of data also. And the participation and leadership of OPDs and advocates with disabilities in determining their priorities and needs, it's of the utmost important to fully represent, support, and advocate for the rights of persons with disabilities. I think I will try to share the link for the reports for you to consult, but if you have any question, I'm always available to answer them. Thank you.
Thanks very much to all the presenters. I appreciate and keeping on time as well. So we're going to turn now to the question and muted myself. So there are no questions in the Q&A, so I invite you to add your questions there, or if you prefer in the chat. But while we wait for people to do that, let me pose a question. First,
Jennifer Victoria has her hand up.
Okay, please take the floor. Victoria, go ahead. Nope. Okay. I don't see the hand anymore. I was going to just, but now there's a question. Good. The slides, yes, the slides, will the slides be made available?
Yes.
Okay. And I'll mention now that, remember, we are recording this, and so after the presentation, you will get the something about the recording, and I assume some information about the slides. Okay, so those are two about the PowerPoint slides. Okay. All right, let me ask my question to Elizabeth or Jose. And this seems to be a very, very broad area when we're talking about citizen generated data in general, but also about OPD generated specifically, and some of the conclusions that that were reported today. So if you were going to kind of prioritize what you think are the next most important steps that the community could take to further citizen generated data by itself and also in conjunction with other forms of data, where would you go and where do you think the next steps are?
Jose, if you don't mind, I'll go first. I also think, Sarah, you can answer this too. So I'll go ahead and then I'll hand it over to you. The next steps it's a very good question. I think that some of the goals that we have are to create a framework that we can use. So this would be a framework with the national statistical offices and communities, marginalized groups. So a framework to ensure that data are reliable, valid, and the real key is to start this process from the start and to co-create so that communities and statistical authorities are working together in the beginning, co-creating, and then co-producing, collaborating. I think that is essential, because otherwise, if the data are created, they might not be accepted later by the community, might not be accepted later. I think that's very important. You're putting me on the spot in the morning, but I could think of some others. Also, I think it's very important to have transparency and inclusion. So ensuring that when a community produces citizen-generated data and it is given over to the national statistical authorities, that the data are used Sometimes we've heard cases where the data aren't used. So that's very important. And then how that data are being used is also quite important, ensuring that there are safeguards and safety for certain communities at risk is also very important. And then, of course, inclusion. So ensuring data are accessible for all people, all persons with disabilities and others. Yeah, I think I'll stop here. Sarah, I'll see if I know you have answers to add too.
Sure. I underline what Elizabeth just said. I think one of the next steps we will have to create is this connection between stakeholders to understand better what is the disability data that organizations of persons with disabilities need for their advocacy, and then create these connections with the national statistical offices to support that creation, because there's not a lot of funding for OPDs to develop sometimes this project. So it will be important to provide more funding, but it is a very good opportunity to complement the data that the national statistical offices are producing, because we're still having a lot of gaps that are not being provided, and probably in terms of census, it will be very difficult to gather that data. So this connection and these partnerships are very important to start getting developed, to not just rely on census data, but get a lot more information on qualitative data, especially what are the barriers, what are the needs, the priorities of persons with disability, which are mainly the data that OPDs underline that they need for their advocacy and to fight for changes in policy.
Okay. I have a question from Delphine. Will you involve the relevant UN agencies and entities such as the WHO and the UNFPA?
I can answer that question. Generally, yes, of course. We do already have partnerships with different UN agencies. UNFPA, for example, in Asia Pacific, we did have a partnership with them. They helped us develop the workshop on disability data advocacy for organizations of persons with disabilities. So, of course, citizen-generated data was part of that. And then in the collaborative, absolutely, there are UN agencies involved. And also, the UN country teams are involved in some of our partnerships, and we're working with them, which I think is invaluable when you look at data on persons with disabilities in the country. So yes, and we are very happy to partner with UN agencies and others, and NSOs and academia and other groups. And I don't know if Jose or Sarah want to also comment on that.
Well, I could add just, I think it could be very important to involve these organizations. For example, the World Health Organization had the reports on the highest attainment of health for persons with disability. This could be very important to connect with the citizen-generated data by OPDs, because some of the case studies, for example, that are in the report is precisely on healthcare and provides valuable information to inform the implementation of the World Health Organization report, for example. So it could be very important. This is a case of gathering all the stakeholders and ensure that everyone has space to either benefit or support the development of data by OPDs.
A very short comment from my side. I just want to echo one thing that Elizabeth mentioned in her previous response. This co-creation approach and the need for having a framework that is inclusive and that we can all discuss how to move this agenda forward. And clearly, we acknowledge that some of the major challenges that many stakeholders have identified has been how to engage with OPDs, how to identify OPDs. But I think the idea of creating this general frameworks where we can include OPDs right from the beginning will serve the purpose of doing it right from the beginning in the most inclusive manner.
Thank you. I have two other questions and I'll go. I don't think there's anything in the chat, but the 10% disabled people mentioned is an estimate at the global level. And does this estimate apply to the country? I don't know who wants to
Is
take
that
that.
for you, Sarah? I think that's for you.
I'm not sure. I don't think it was mine. Let me know if it was mine.
I don't think so
Uh,
either, Sarah. This might be referring to an old a WHO estimate, perhaps, at the global level. I mean, do you want me to take a shot?
Yes, please.
Yes,
I may be
yeah.
missing the point completely, but you know, any estimate that's made at the global level is an estimate, and it does not imply that estimate will apply in any given place, whether it's a country or a region or a city or someplace even smaller, because there's a lot of factors that would determine whether or not one would identify the population with disabilities in that area. And my favorite kind of going back to statement is, whenever you say 10% or X% of the population has a disability, it's really good to say how you defined that population, because it will vary greatly. And the age group that you're referring to, among a variety of other things, as we know just how complicated disability is. So I think that perhaps is what that question is referring to, but I'm going to add to it just a little bit. In the work that the Washington Group has done, where we have advocated for putting the set of questions that identify the population in a variety of different data collections, you always find that you get a different estimate no matter what data collection you put it in, because of the structure of that data collection. You're now kind of, in a good way though, expanding the sources of information, and therefore all of those sources are going to have kind of their own, not how they're defining it, how they work, all of the implementation issues, and you're going to get different estimates of what looks like the same thing. How can we address that up front without waiting for data to be collected, and then people say, wait, you know, I did that survey here and you did it there in the same country, different time, we got different answers. Why? It always comes up. It's always hard to deal with after the fact, but is there a way that we can deal with it before the fact? And maybe some of these webinars might help to kind of sensitize people to the differences in data collection method, and that they do show up in the final estimates. If you have any thoughts about that.
I think you answered it perfectly.
Okay, so maybe we should talk about having a webinar on multiple estimates. I have a question here from Margie Schneider. How have stats offices collaborated on using citizen-generated data generally, especially for disability data? Do they welcome the data? And also other ministries such as health and education?
I can answer that. We have very good examples in a few countries, and I can highlight them here. Kenya is very, very good on this. Ghana, Colombia, Bangladesh, and around disability data, especially I'd say Kenya, and also the Philippines. We actually have a report, which I can't access the chat box, I'm sorry, so I will share it later. But it's a report on citizen-generated data led by the community for a local town. And then now it's being replicated, and they did match with the local government. They worked with the local government and the local health ministry. So they matched health ministry definitions of disability type with their data collection, and then they created a registry. So it's a perfect example of this collaboration. And it was so successful, it's now being replicated around Manila in different towns. So that's, I think, a wonderful local example. And then in Kenya, and I know Karen Bett is on this, so maybe she wants to add something, but Kenya is an excellent example where a lot of different stakeholders have come together to work on inclusive data, including disability data. This includes the National Statistics Office and different organizations, NGOs, organizations, community organizations, and there is even a working group on citizen-generated data developed by the government. So that, I think that's a wonderful example to highlight. And I don't know if anyone else wants to add to that question.
Okay.
I can just add quickly on the reports because we had analyzed several cases. We are aware that there were some connection in developing advocacy tools and using this data for advocacy and trying to change policies. But there's still not a lot of information on how much it impacted national statistical offices. And the answers on if their NSO recognized the data were a bit contradictory. So it might be important for the NSOs to publicly say if they are open to this sharing of data and to contact and make connections and a network with the OPDs, the local OPDs, to ensure that they know what data that they need, how can they send data for the offices, and how this partnership could take hold.
The next question is from Arthur Littman. What will be the impact of the citizen-generated data to persons with disabilities, particularly to persons with mental health and psychosocial related to creating programs for employment and livelihood where they are greatly discriminated or worse, banned from working? Do you want to take that one, Elizabeth?
Jose, do you want to?
Sorry, Tia, could you quickly repeat the question, Jennifer? I'm not sure I fully understood it.
Okay. What will be the impact of the citizen-generated data to persons with disabilities, particularly to persons with mental health and psychosocial related, to creating programs for employment and livelihood where they are greatly discriminated or worse, banned from working?
Perfect. Thank you, Jennifer, and thank you for the question. So I think that question is a great example where the citizen-generated data can be an additional tool of gathering information, right? From an OPD perspective, I think we all know that persons with disabilities usually first go to local organizations where they can find services, where they can find support. So the fact that a lot of persons with disabilities, and I would say especially those with psychosocial disability and other people coming from underrepresented groups, the first place that they usually go are OPDs, right? So if those OPDs are collecting that data and through citizen-generated data frameworks, that data can be used for designing or defining priorities and initiatives. It's a good chain of actions, how we can contribute as OPDs in this more effective and collaborative way of having data.
Did anyone want to add to that?
If I go Liz.
No, go ahead, sir.
I was going to add, I think it could be immensely important because there's different levels of involvement. There's participation, but with citizen-generated data, we normally get leadership of the community on their own data. I'll give you an example. I was recently involved in a project on autistic people with mental health issues and their access to mental health services support. And what we developed was community-generated data by an OPD and that centralize their experiences and then involves mental health professionals who are allied and have experience with autistic people into reading and getting involved with their experiences and trying to understand, okay, what we need to change in the services. So I think citizen-generated data can potentially pass us from participation in data to leadership into designing and defining what data we need to improve our rights.
Do you want to
I have
add something?
No, they were perfect.
Okay, next question is from Jacqueline Mutai. Actually, two questions from her. What would be your advice on trying to get the citizen-generated data used in planning and programming at the country level? And who would be best placed to push such an agenda? Actually, it's just one question. Anyone?
I'm happy to start. I think it's very much tied to what I already mentioned, that working together in co-creation is very important, and having the community lead and be involved in all processes, all steps of the data cycle is quite important. I think that working with local authorities is really integral in this process. So if you have relationships and you are providing critical data to fill gaps, that is wonderful. So if you're complementing the data that are already there, helping fill those gaps where there's a need, I think that is a very good way to influence and to answer your question. And I'm sure Jose and Sarah have more to provide.
Nothing else from my side. You said it all, Elizabeth.
Yeah, I was going to say the same as Liz.
Okay, good. Okay, and a question from Fayel Ashing. I'm sorry, I mispronounced your name. I was wondering about how to respect the privacy of people with disabilities as we generate data. For example, issues around legal capacity for people with intellectual disabilities may be in regards to right to sex, sexual reproductive health. So what can we focus on and what should remain private? Just something floating in my mind.
Well, Jennifer, I don't know if I'm putting you on the spot, but I think I have heard you responding to similar questions. So I don't know if you have a thought on that, but also Elizabeth and Sarah may also have something to contribute with.
It is a difficult question. We were talking about collecting data in a slightly different situation, but an educational situation where the school has now certain information and how will they use it. So I think it is part of the larger question. Sometimes I felt very privileged that I come from a statistical agency where there's a very clear history and ethical and often legal requirements about the protection of data and confidentiality, and also only using data for the purposes for which it was collected. And there's a long history of that in statistical agencies, but they are somewhat unique in that, I mean, there's to some extent academia, but the legal and regulatory protections are usually not as strong. When you're moving into other players who I want to say coming new, but don't have that kind of history, I think we have to develop the same kind of ethical guidelines, strong ethical guidelines, and I don't know, every legal system is different how you can do it legally, but certainly ethically, along with all of the good work we do on the technical side of data collection, we have to do the same kind of work on the ethical side. And there has to be, in each situation, some kind of way of protection. Someone should be kind of in charge of making sure that data are not used in any negative way. Part of that is being very upfront about how you're going to use the data. And when you move from pure data collection and analysis to then using the data in real life, in real time for real people, it is a different use of the data, and people have to understand that. I don't have a good answer.
That is a great answer. And I think we lost Jose, but I have nothing to add anyhow.
Sarah, did you want to?
I can add just, I agree with you. I think it's an ethical issue. I think, for example, if we are providing or gathering data from people that are in situations that are particularly vulnerable, for example, people that are institutionalized and they are providing data of abuse, for example, we have an extra layer of responsibility to ensure that that data remains anonymous and that person is not exposed and potentially worsened abuse, for example. But I think this is creating this framework that Liz talked about earlier on how can we make better and improved data and how to support OPDs to do them and create this ethical and data framework to ensure that responds to these issues.
Well, perfect. There are no more questions and we're at time. So on behalf of the Washington Group, I want to thank our three wonderful presenters for partnering with us in this webinar. I think there are a lot of good ideas were raised for additional webinars to address some of the important questions that were brought up, different estimates. I'd like to spend more time talking about how to create a comprehensive model that builds on all three so that we can use data more appropriately. And some of the important issues about building the new framework and getting buy-in for the use of citizen-generated data. So again, you will get the recording of this, and I encourage you to contact any of the sponsors, International Disability Alliance, the Stakeholders Group, Elizabeth CBM Global, if you have ideas for other things that we should be talking about, because we would love to have a good series of webinars. So I hope you all have a wonderful day, evening, afternoon, wherever you are, and hope to see you soon on another webinar. And thank you again to all the presenters. Bye-bye.
Thank you.
Thank you.